Hello, beautiful people. It's Steffi B, and I'm here to study with you guys. And today we're going to do 10 questions on comprehensive material. All right, so this is part 3. There's a lot of material that we need to know, so I made 5 parts. All right, so there's going to be a part 4 and a part 5. All right, so if you didn't watch part 1 and part 2, I suggest you watch it. And let's get started. Number 1. A nurse is caring for 4 clients. Which of the following tasks should the nurse delegate to an AP? 1. Arrange the lunch tray for a client who has a hip fracture. 2. Measure the vital signs of a client who just returned from PACU. 3. Evaluate dietary intake for a client who has anorexia. Or 4. Assess INOs for a client who is receiving dialysis. Here the answer is number 1. Arrange the lunch tray for a client who has a hip fracture. Why is that the answer? Let's look at the question. What are we looking for? We're looking for a task that we can delegate to an AP. Let's look at the answers. So number 2, can we delegate measuring vital signs for a client that just came to PACU? No, right? Because we want to evaluate that patient, right? So they just had surgery, they're in post-op care, right? So we need to assess, we need to evaluate, right? So that is going to be tasks for an RN. So we do not delegate that for an AP. Number 3, evaluate dietary intake for a client with anorexia. So evaluating and assessing is for an RN. That's within the scope of practice for an RN. So we do not delegate that. Number 4, assess INOs for a client who is receiving dialysis. Again, assessing is within the scope of practice of an RN, right? So assessment, so that requires professional nursing knowledge, right? So that is for the RN. So here the answer is number 1. So that is within the scope of practice for the AP. Number 2, a nurse is caring for a client who's receiving a continuous heparin infusion. Which of the following lab tests should the nurse review prior to adjusting the client's heparin? 1, PTT, 2, PT, 3, INR, or 4, WBC count? All right, so here the answer is number 1. So it's going to be PTT, right? So let's look at the question. So which lab tests are we looking for heparin, right? So that's the information we're giving. That's what we're looking for. Let's look at the options. So let's look at number 2, PT. What lab test is that for? Warfarin, right? INR, what is that for? Warfarin. WBC count. So that is if a client has a fever, they're immunocompromised, right, or have an infection, right? So number 1, PTT, that is for heparin. A good way to remember that is if you put the 2 T's together, it looks like an H for heparin, PTT. So number 1 is the answer. Number 3, a client who has high blood pressure is having difficulty following their treatment plan. Which of the following factors should the nurse recognize as being the greatest barrier to the client's ability to be compliant? 1, a detailed plan of care. 2, absence of symptoms. 3, dietary salt restrictions. Or 4, addition of a new medication. And here the answer is number 2, right? Let's look at the question. What are they asking? They're asking for a factor, right? That can be a barrier for the client to be compliant, right? So what would be an issue for them to be compliant to their medication? Let's look at the options. Number 1, a detailed plan of care. Might be really confusing, right? And really long, but it's not the greatest barrier to be compliant, right? And then number 3 and number 4, dietary salt restrictions, addition of a new medication. It does not indicate a barrier of compliance, right? So if we look at number 2, so if a client doesn't have symptoms, they might feel like they don't need to be treated anymore with that medication, right? Like, oh, all right, like I'm fine, right? I don't see any symptoms. I shouldn't keep taking the medication, and they might stop taking their medication, right? So we need to encourage that patient to continue to take that medication, right? The reason they're feeling better is because they're taking the medication, right? So the answer here is number 2. Number 4. A nurse is teaching a client who has a new prescription for digoxin about manifestations of toxicity. Which of the following findings should the nurse include in the teaching? 1, constipation, 2, nausea, 3, wheezing, or 4, muscle rigidity? Here the answer is number 2, nausea. Let's look at the question. What are they asking? So they're asking us, which of the following findings should the nurse indicate, right, for digoxin toxicity, right? Let's look at number 1, constipation. Would constipation tell us that this person is at risk for digoxin toxicity? No. Diarrhea, right? That would be a symptom. Number 3, wheezing. If a client is wheezing, that's a manifestation of anaphylaxis, right? Not digoxin toxicity. Number 4, muscle rigidity. No, so muscle weakness would be a manifestation of digoxin toxicity. Right, so number 2, nausea. Yes, so we would want to monitor and report any symptoms of digoxin toxicity, right? So if we see nausea, anorexia, right, abdominal pain, bradycardia, visual changes, right, we want to report that. So here the answer is number 2. Number 5. A nurse is assessing a 2-month-old infant during a well baby examination. Which of the following actions should the nurse take to assess the infant's rooting reflex? 1, stroke the infant's cheek. 2, depress the infant's tongue. 3, turn the infant's head to one side. Or 4, tap on the bridge of the infant's nose. Here the answer is number 1, stroke the infant's cheek. So why is that the answer? Let's look at the question. The question is asking us, so which action should the nurse take to assess the infant's rooting reflex? Let's look at the answers. Let's look at number 2, depress the infant's tongue. So if we depress the infant's tongue, what is that doing? That should cause the infant to stick their tongue out, right? So we are testing their extrusion reflex. Number 3, turn the infant's head to one side. So if we turn the infant's head to one side, they should extend their arm and their leg on that side and flex their arm and their leg on the other side, right? So that is called asymmetric tonic neck reflex. Okay, number 4, tapping the bridge of the infant's nose. If you tap their nose, they should close their eyes tight, right? So that's assessing their glabellar reflex. All right, so here the answer is number 1, stroking their cheek. That is assessing their rooting reflex, right? So if you stroke their cheek, they should turn to that side and suck, right? This is with breastfeeding, right? So here the answer is number 1. Number 6, a nurse is caring for a newborn whose parents asks why the baby is receiving vitamin K. The nurse should explain to the parent that the newborn should receive vitamin K to prevent which of the following? 1, bleeding. 2, potassium deficiency. 3, infection. Or 4, hyperbilirubinemia. Here the answer is number 1, bleeding. So why is that the answer? Let's look at the question. So the nurse should explain to the parent that the newborn should receive vitamin K to prevent what? So with vitamin K, with the newborn is deficient in vitamin K, right? So if they're deficient in vitamin K, it can cause them to bleed, right? So the answer here is number 1, bleeding. Number 7, a nurse is caring for a client who has MRSA in an abdominal wound. Which of the following precautions should the nurse implement? 1, airborne. 2, droplet. 3, contact. Or 4, protective environment. Here the answer is number 3, contact, right? Let's look at the question. So the question is saying this client has MRSA, right? So we have to think of precautions for MRSA. Let's look at the answers. Let's look at number 1, airborne. So with airborne precautions is MRSA considered airborne? No. Tuberculosis and measles would be considered airborne. Number 2, droplet. So would droplet be considered MRSA? Would MRSA be considered droplet precautions? No. So pneumonia or influenza is considered droplet. Number 4, protective environment. Is that needed for MRSA? No. So somebody who has who's immunosuppressed, right? So if they're going through a cancer treatment, then they would need protective environment measures, right? So number 3, contact precautions. Yes, so if somebody has MRSA, they would be on contact precautions. So here the answer is number 3. Number 8, a nurse is caring for a client who is post-op after receiving moderate conscious sedation. The client suddenly becomes restless and reports feeling lightheaded. Which of the following actions should the nurse take? 1, check the client's temperature. 2, prepare to administer acetylcysteine to the client. 3, place the client in Trans-Dellenberg position. Or 4, check the client's oxygen saturation level. All right, so here the answer is number 4, checking their oxygen saturation level. Okay, let's look at the question. Let's see the information they gave us. They said that there's a client who's post-op receiving moderate conscious sedation, right? So they become restless and reports lightheadedness. So just looking at that information, what does it mean when a patient is restless? Usually that means hypoxic, right? So let's look at number 1, check the client's temperature. So usually with a patient that has general anesthesia, we would look at malignant hypothermia, right? Then we would check the temperature. But here they're receiving moderate conscious sedation. Number 2, prepare to administer acetylcysteine to the client. No, acetylcysteine is an antidote for acetaminophen, right? But here, the client might require a medication to reverse the effects of the moderate sedation, right? They didn't say that this patient is taking acetaminophen. Okay, number 3, Trans-Dellenberg position. So that is used to promote venous circulation, right? So the blood returns to the heart. But if a client is hypoxic, then you would want to actually elevate the head of the bed, right? For lung expansion, right? So the answer here is number 4. You want to check their O2, right? If they're lightheaded, if they're restless, those are signs that they don't have enough oxygen, right? So they're being restless, right? So here the answer is number 4. You want to check their O2. Number 9, a nurse is planning care for a client who has thrombocytopenia. Which of the following instructions should the nurse include in the client's plan of care? 1, avoid venipunctures when possible. 2, restrict visitors to family members. 3, limit oral fluid intake to between meals. Or 4, prohibit fresh flowers in the client's room. And the answer here is number 1, avoid venipunctures when possible. So why is that the answer? Let's look at the question. The question is asking us, so what instruction should the nurse include in the client's plan of care for a client who has thrombocytopenia? What is thrombocytopenia? So that is when a client has a decreased platelet count, right? Let's look at the options. Number 2, restrict visitors to family members. So if you're restricting visitors, who do we do that with? Patients that are that have neutropenic precautions, right? Let's look at number 3, limit oral fluid intake to between meals. If we limit fluid intake, right, so it would improve the appetite. So this is for patients that are anorexic, right? Number 4, prohibit fresh flowers in the client's room. So this is also for a client who has neutropenic precautions, right? So that is to reduce the risk of infection. So here the answer is number 1, right? So if they have a decreased platelet count, they're at risk for bleeding. So the answer here is number 1. Number 10. A nurse is assessing a client who has multiple sclerosis. Which of the following manifestations should the nurse expect? 1. Abdominal striae. 2. Mask-like face. 3. Nystagmus. Or 4. Ptosis. So here the answer is number 3. Nystagmus. Right? Let's look at the question. So this client has multiple sclerosis. We're looking for a manifestation. Let's look at number 1, abdominal striae. We see that with a client that has Cushing syndrome. Number 2, mask-like face. We see that with a client that has Parkinson's. Number 4, ptosis. We see that the drooping of upper eyelids. We see that with a client that has myasthenia gravis, right? So here the answer is number 3, nystagmus, right? So if a patient has multiple sclerosis, they will have involuntary eye movement, right? That is a manifestation of MS. So here the answer is number 3. All right, guys, that was 10 questions on comprehensive material. That was part 3. There's going to be a part 4 and a part 5. Guys, if you like it, like it. If you want to leave a comment, leave a comment. You guys already know. Thank you for studying with me, and good luck. Bye, beautiful people.